Hello, and welcome to the University of Fredericton Mental Health in the Workplace podcast. My name is Sarah Chesson, and I'm the Marketing and Communications Manager here at UFred. As part of UFred Mental Health Week and in support of Let's Talk, we have Dr. Joti Samra here to speak with us about the importance of education around workplace mental health. Dr. Joti Samra is an innovator in the area of psychological health and wellness in the workplace. Her research catalyzes fundamental improvements in the psychological health and safety of work environments throughout Canada. She pursues a full spectrum of research, consulting, and educational activities in the field of workplace health. She's the lead developer of Guarding Minds at Work, a workplace guide to psychological health and safety, an innovative online resource to address psychological threats in the work environment, and was also a member of the technical committee that developed Canada's first national standard on psychological health and safety in the workplace. She's also the principal developer of Managing Emotions, a set of online interactive assessment and training resources that strengthen the emotional intelligence skills of managers. Dr. Samra is a frequent media commentator and presents her work extensively at the invitation of organizations across North America. In addition to being the program lead for the University of Fredericton Centre for Psychological Health Sciences, she's also director of an organizational and media consulting practice, and she maintains a clinical practice in Vancouver, BC. Dr. Samra is also one of Let's Talk's volunteer clinical experts in Western Canada. Welcome, Dr. Samra.
Thank you for having me, Sarah.
So, Dr. Samra, can we start by getting you to tell us a little bit about yourself?
Sure. So I am a clinical psychologist. I've been born, raised, and practiced in Vancouver, British Columbia. And I have a really kind of interesting mix of things that I have the honor of being able to do. I have a 2-day-a-week patient practice located in downtown Vancouver, where I do primarily treatment, adult individual treatment and couples treatment, and I also do some assessment work within the legal domain, so assessments for individuals that have suffered psychological injuries in the workplace, motor vehicle accidents, or other kinds of situations. I also do a lot of consulting in the media realm, so often am called to comment on human behavior issues, on news stories that are kind of relevant and kind of in our media. And then I do consulting with companies around creating psychologically healthy and safe work environments.
That's really interesting. So what was it that first interested you in workplace mental health specifically?
Well, I look back now and think I've always had this strong interest in workplace health. Likely, I think that came from 11 years of being in graduate school. So, for anyone who's been in school for a long number of years, we know that it can be kind of all-consuming. And part of what came along with being in school for so many years was I needed to kind of work throughout. And so I became really kind of aware, I think, of just kind of how work would impact me and how it affected things like mood and energy, and certainly I know from my own experience when things at work are going really well, it can feel like a fantastic place to be. If you have friends at work, if it's a collegial environment, if people are civil and respectful, if you feel that you're making a difference and part of a company, it feels really great. And conversely, unlike many people who have had experiences at work, and we realize when it's less than ideal, if there's conflict, if there's lack of good leadership, if there's poor communication, that can have a really negative impact on our energy, on our mood, and our satisfaction and engagement with work.
Absolutely. So in your opinion, then, what are some simple things that employers can do to promote a healthier and safe workplace?
There's a number of things, and I think as a starting point, it's employers' responsibility to educate themselves and be aware of how mental health issues can manifest in the workplace. The reality is most of us spend many of our waking hours at work. We spend many more hours at work and with people that we work with than we often do with our own family or friends. And the reality is it's almost impossible for us to separate out things that impact us personally from our work life, right? If you're spending kind of 40 hours on average, give or take, a whole host of people will be spending more than that at work. It really becomes important to make sure that we're in environments where employers understand the entire person in all parts that we bring to the workplace. So understanding and awareness is the first step. There are a tremendous amount of resources that have been developed and really kind of exploded over the last decade, and free evidence-based resources that employers can start to access to help kind of start a conversation with their work environment. So in addition to kind of being aware of mental health issues, it becomes important for employers to start to say, how can we talk about mental health in our workplace? Many workplaces now will have health and wellness strategies, so they might offer gym memberships, or they might have someone that leads yoga at lunch, or they might even have on-site services that are available, health testing, health screens. And I encourage employers to think of those models for physical health and apply it to mental health.
That's great. So from the employee perspective, what do you think are some things that they might be able to do if they're struggling with mental health issues as well to help each other and their colleagues and themselves?
Well, I believe that we all have a responsibility to be aware of things that are happening to us and things that might impact those that are around us and things that we do, and work is part of that. So the same way, we'll be aware if we have a bad flu and we're contagious and we feel that we might not be able to get our work done, many people will say, I'm going to pay attention to that. I might communicate that to my workplace. I might take a day or two or a few off if I need to get healthy in return. And we all kind of accept that as a very kind of normative behavior to engage in. And I think what's important for us to do is to start to kind of take that same kind of approach to our mental health. So doing check-ins with ourselves on how we're feeling, what factors are impacting us. The kind of S word, stress, really does impact us significantly. And it's important for us to pay attention to both the stressors that we're faced with and the impact that they're having on us, and to be able to kind of seek support or make changes in our life when we realize we're getting overwhelmed and when things like work function might be getting impacted.
Yeah, absolutely. So, Joti, talking a little more broadly now, could you tell us a little bit about some of the current research that you're doing?
Yeah, I've been involved over the last really kind of 15 years in doing a lot of kind of work, research, consulting in the whole area of workplace mental health. And about a year ago, I was commissioned by the Great West Life Center for Mental Health in the Workplace to lead a national research project on workplace mental health through the University of Fredericton. And the aim of that project was to examine the evolution of workplace mental health over the last decade in Canada. So really kind of seeing what has happened, what has developed, and taking a look at kind of the state of workplace mental health right now. What's been really amazing to see is that if we kind of rewind to 10 years ago, very little was being done within the realm of workplace mental health. So there were a small group of people and representatives at agencies that were starting to be aware of the importance of paying attention to mental health, but we really had no kind of structured or systematic approaches that would guide people on what to do to address workplace mental health issues. And really a real dearth and absence of resources that existed out there. And what's been amazing is there's been a small kind of number of group and agencies that mobilized really this movement that began about 10 years ago. And now we're in a state as a country where we have, most significantly, a national standard for psychological health and safety in the workplace. This is the first comprehensive framework that is available for employers to utilize in order to assess, respond, and evaluate workplace psychological health and safety. And it is the first and only standard of its kind in the world right now. And we know that the International Labor Organization and International Stress Organization is starting to pay attention to the work that we've done here in Canada. So personally, I was involved in leading a body of work for a number of years called Guarding Minds at Work, which was a whole set of evidence-based, free resources that employers can utilize to enhance the psychological health and safety of their workplace. And that kind of work set the stage for the psychosocial factors which the national standard outlines as being important for workplaces to pay attention to. And I was very honored to sit on the Canadian Standards Association committee that developed this national standard.
Wow, it sounds like you're involved in a lot of different things. It'll be really interesting to see how some of this research pans out and to see kind of, I guess, where we are right now in terms of psychological health and safety in the workplace. So
it's very exciting. Lots has been done, lots to still do, certainly, but I think it puts us in a good place as employers and employees to say we now have guidelines and structure and best practices and resources, much of which are available in the public domain that can help us achieve that end goal.
Yes, absolutely. So, Joti, you're also working as a volunteer clinical expert for Bell Let's Talk in the Western region here in Canada. So what type of work are you doing with the campaign?
Yeah, I've been a volunteer clinical spokesperson for the campaign since its first year. And what I do the kind of week of Bell Let's Talk is I get involved in communicating kind of knowledge and information through media on mental health issues. And really the kind of overarching campaign is intended to put attention to and start a dialogue about mental health issues. And it's intended to educate, increase awareness, and ultimately reduce stigma. So through that, what I do is make myself available to various media sources, and I'll be conducting a number of interviews, radio and TV, on different topics related to mental health, to encourage people to really spend some time, energy, thoughtfulness on considering mental health issues on Bell Let's Talk Day, which is January 25th.
That's great. That's awesome to hear. So are there any resources that you could really point us to that you'd recommend that people can take a look into for either their workplace or more personally and that kind of thing with respect to mental health?
Yes, I have a number of resources, both for employers and employees, that are linked on my website, which is my name, all is one word, drjotisamra.com. And I've been very intentional in the resources that I've linked on my site. So I've put things that I've vetted to have an evidence-based, and the bulk of the resources that I've linked to are public domain, which means they're freely available and easy to access. So that's a good place to start. Some of the sites that I have linked there that are great sites to go to are the Great West Life Center for Mental Health in the Workplace. They have a workplace strategies website. So if you Google Great West Life and mental health in the workplace, a portal will come up. You don't need to have any association with Great West Life to access the resources. And there's a whole breadth of resources, all the way from training guides to videos to templates to links that employers can utilize and access for free. So you can go to that site and you'll have, for example, access to PowerPoint presentations that you can utilize and deliver or structure training around within your work environment. The Here to Help BC website is also a fantastic site. So it's heretohelpbc.ca. And it's the most comprehensive site that I've come across to date that offers resources that are translated in upwards of 10 different languages. So there's a whole number of free resources to help give understanding and awareness and education about treatment for virtually all of the main mental health conditions. And there's also some toolkits that are on that site for family members who may be wanting to learn a bit more to help support a loved one that's suffering with a mental health issue.
That's great. Thanks, Joti. So we can find more information about you, of course, on UFred.ca, where you are the program lead for the Centre for Psychological Health Sciences at the University of Fredericton. But where else might people be able to find you, let's say, on social media?
Yeah, my website, and I'm on kind of various social media, so Instagram, Twitter. I have a Facebook page, Dr. Joti Samra, and you can kind of find me by searching for that handle for all of them. And what I do particularly on Facebook and Twitter is I regularly link just useful articles about mental health, workplace, and others. So things that people can read and access that can help really kind of increase all of our understanding and awareness about mental health issues.
Perfect. That's great, Jodi. Thanks so much for taking the time to sit down with us today. We really appreciate it.
You're welcome. It was my pleasure to join you.